Good afternoon. I have the pleasure of moderating, introducing a panel on opportunities to further the knowledge base, and I think I would amend that to opportunities for further the knowledge base and program development in this area, because we're going to hear about some efforts to do that. We're going to hear from Karen Blitz from the Administration of Children, Youth, and Families about the United States Interagency Council on Homelessness, a youth framework. We're going to hear from Catherine Heath, the Children's Bureau, about initiative grants developing a model approach for addressing the needs of foster youth at risk of homelessness. We're going to hear from Maria Wolverton about the next generation Chafee evaluation planning, and full disclosure, I'm involved in that project. And we're going to hear from Tammy White about the National Youth Transition Database. I was invited to make a few comments, and so I never miss such an opportunity. So listening to the presentations and having read the slides already and not wanting to steal anybody's thunder here, one of the things that really strikes me about both the opportunity and challenge for doing something around homelessness for this population is how much it calls for, we've heard these terms, collaboration and the various systems that need to be involved, and folks acknowledging that, well, we're talking about homelessness, but really if you're going to talk about homelessness, we need to address employment and education and the psychosocial needs of these young people, which of course immediately makes it a much broader discussion. And I found over the years a term that the folks in the United Kingdom use, it's an explicit part of their policy. They use the term corporate parenting. And what that implies is the notion that when children enter the care of the state can never be a parent. The best the state can do is sort of arrange a bunch of responsible adults and resources to support children and young people. And the UK policy is quite explicit, this notion of corporate parenting. It says here the role of the Public Child Welfare Agency is sort of to at the end of the day, be held accountable primarily for this, but all of the other systems have a role: education, employment, health. They have a national health care system, and they're quite explicit about the roles of those systems. I think that's implicit in our policy. It's not as explicit. We don't use the term corporate parenting. But we hold the Public Child Welfare Agency accountable in a different way than we hold these other systems. And as we talk about NIDED, we now have a national transition database that's collecting data. The Child Welfare Agency is collecting those data. And it's on a population defined around the Child Welfare Agency population. But if you look at the Workforce Investment Act, you look at the Higher Ed Act, you look at housing FUP, you see policies that acknowledge the responsibility of these other systems to help this population. So I think we have implicit this philosophy. But a couple of things that come up that I think are useful to think about as we consider moving things forward is huge variation across the country, both between states and within states, and between these systems in their philosophical approach to this notion of corporate parenting. So I'll just use one example. Congress, I think wisely in reflecting political realities in this country, has extended foster care, given states the option of extending foster care to 21. States don't have to. That's a big philosophical statement at the end of the day. It's not just a fiscal statement. It's a philosophical statement for a state to say, we're going to continue to be corporate parent, if you like, of young people into adulthood. And all you have to do is talk to folks in California if you want an appreciation of how difficult a change that is culturally, and what a different philosophy that is. The difference between we're going to prepare young people to be on their own by the age of 18, and then we might have some services after that, but at the end of the day, we are not responsible, which is still the policy of most states in the country, is fundamentally different than a state that says, well, we're just going to continue to be responsible for this young person into adulthood. And we're even going to allow the court to weigh in every 6 months and tell us whether we're doing a good job or not, right? So there's philosophical differences around our attitude about this. We heard in the last panel, well, we're really careful here because we don't want young people to become dependent on the state, which I completely understand that. I have 2 adult young children in this age range. I don't want them to be entirely dependent on me. On the other hand, half of young people between 18 and 24 in this country live at home. A quarter of young people 24 years old live at home. Young people can expect close to around $40,000 in direct assistance between the ages of 18 and their early 30s, and lots of in-kind contribution. Is that dependency? Is that dependency? I think you know, we could have an interesting philosophical debate over that. So there's a philosophical issue, and then there's the how do you do it, the nuts and bolts issue. We've heard some great presentations around different approaches around the country in this realm of housing and child welfare, of how we bring these various parties together, whether it's housing, employment, health, et cetera. That gets very complicated. And one of the big complications is variations between states and policy. I just mentioned one, whether you extend care or not, but also within states. And one of the things we haven't heard a lot of, but we heard some of it here, is Colorado, Denver. But I'm willing to bet, in fact, you kind of said this, it's not like all of Colorado has this partnership, right? And I've worked in a number of county-administered states and seen entire areas of a state where entire realms of services do not exist. And that's just kind of the way it is because counties are allowed to operate at that level of freedom. You even have state-administered systems, by the way, that vary quite a bit. Illinois would be a good example. I happen to live in Illinois and I'm aware of that. So I just find those to be really interesting lenses through which to think about this. And I know that the folks who are following me on this panel, that all of them in their own way will touch on these issues of, you know, what's the philosophy, what are the tools we can use, and then hopefully on the data side, how can we learn about how those different philosophies and different approaches to the nuts and bolts actually play out in the lives of these young people. So I look forward to the panel. And so first I'll introduce Karen Blitz from the Administration for Children, Youth, and Families.